So today I focus on the issue of the epistemological contribution of women's health to public health and to health innovation. When I mean epistemology, I mean the study of the nature of knowledge, the rationality of belief and justification. We discuss just a little bit of this. And thinking about feminist epistemology as being concerned on the way in which gender influences our concepts and knowledge. And women's health is a very good and dense example of how this knowledge is biased in terms of gender content. So the medical knowledge is very biased in terms of gender. And this reflects very much on how public policies are oriented. So I will talk a bit about innovation, the idea we have of innovation, because generally we think about innovation as patents and new apps and this kind of technology. But in public health, we have to think a lot on innovation as a technical change or a new way of acting in the work process related to health promotion or disease prevention, which has an effect on the epidemiological situation of a given population. This is called relactation. In Brazil, we have several programs on this. What is innovative on this is that generally, when the baby is not gaining weight properly, we say, oh, we gave formula, isn't it? But now we very much know that formula is very inferior to breast milk. It's, you know, the metabolic prognosis of the baby is completely different if it has formula, it has breast milk in terms of inflammatory diseases and obesity and several other diseases, right? So relactation is something that's very simple. It's a great innovation in terms of helping women resume the production of milk. Of course, there has to be a lactation consultant, someone with patience, you know, able to inform women about this. So this is a form of innovation that is very underutilized because there are conflicts of interest related to this, you know. So this is one of the priorities that we think that we should deal with in public health. And women had a very strong participation in the Brazilian health reform movement. It was a movement for universal health care controlled by society, and women brought a concept that's very interesting. It's the idea of integrality or comprehensiveness of care. So this is the idea, for women that was a very complex concept because it included not only the alma ata idea of primary, secondary, and tertiary care, you know, prevention, treatment and rehabilitation, but also the idea that women should be cared for, not only in reproductive age, but also from childhood to adolescence and after menopause and aging, and also the idea of the bio, psycho, and social dimension of health. So this was a very interesting movement because we had by that time only this very, we call maternal-infantilistic care, you know, that was women were treated basically until the 80s. We had just two health programs for women. It was antenatal care, antenatal and childbirth, and the other one was breast and cervical cancer. That was the two programs. So that put together a whole agenda of women's health. It was very interesting. So the movement had this agenda, and there was a very strong political participation of women with a whole network built in terms of building this program. There was a very broad agenda. Sexuality and sexual diversity was very present since the beginning. The racial issue was there, violence against women, a very strong critique of medicalization, many issues about health, education, self-help. Mental health was very present. That's, you know, aging was there. So it was a very broad program. This was pre-Cairo, pre-Beijing, pre-sexual and reproductive rights as was. It were formalized, you know. I think that it contributed to this. We called it a public health feminist agenda. So it was very interesting. Today, there's a huge process of recovering all the educative material of the PAISME because it's very, everything from epidemiological surveillance in women's perspective to health education to everything. It was really a very interesting, what we call in Brazil feminist infiltration of public policies. So we have, let's say, a new agenda for women's health. The new and the old issues that became visible. So violence against women becomes a health issue in Brazil. So we have the creation of the first service for sexual violence and so on, specialized service to deal with women who are raped and all specialized care for these women. And the idea of sexual and reproductive health right post-chiral and pre-chiral also. Since 1991, we have a very active national network on sexual and reproductive health and rights. That's called Rede Saúde. So we have a different context nationally and internationally, because from the AIDS epidemics on, the priority in this moment is to have access to drugs and to technology, because people's life depended on this. So there's a whole shift from demedicalizing to medicalizing because of the epidemics, which is very strong recently in Brazil. So we had this very strong public response, but very strong social movement. And in Brazil, we have this gay movement that's very strong. We have the gay parade that's with millions of people in the street, really millions. We have 1 million, 2 million people in the march. We have, since 1989, a universal health system that HIV and women's movement helped to shape. They were very important in terms of political shape. In the women's movement, there was strong dialogue and interconnection between social movements and public policies. This is very much a characteristic of this Brazil, the Brazil in the 90s, in the birth of this movement. And for instance, there is in the health ministry a program called Brazil Without Homophobia. It's a human rights program in the HIV/AIDS response. It's a very strong human rights response in health movements. So this is a picture of the parade. It says, I'm happy, gay and Christian, because there's even a religious response related to this. Now it's a very strong polarization about the religions. I think that we had more religious support by that time than we have now. And also there was very beautiful graphic material, like this, the very sex positive. They say, do whatever you wish, but do it condom. So the idea of you can have eroticism and safety at the same time. But at the same time, there's a shift in women's material on health. And I'll show you some of the campaigns of the national network. So these are the campaigns. And what are the themes of the campaigns? I'm part of the network. I'm very proud of this. But I'm going to show the shift that we did. So we have 5 campaigns on violence against women and a health issue, 4 on abortion, 3 on maternal mortality, and 3 on HIV/AIDS. Yes, there were feminist material on childbirth, not directed campaigns, but there were. Very interesting. But the campaigns were based mostly on safe abortion, which is a very important problem because in Brazil we have basically unsafe abortion. On safe motherhood, because maternal mortality is high and it's not decreasing. Safe sex, which is definitively a problem, and the ultimate safety issue, which is violence against women. So we shift to how to survive sex and relationship. The sex positivity and the good part of reproducing and the health promotion, etc., was very much eclipsed by we could even say the epidemiological situation. The issue of that optimism in the 80s was substituted by the issue of safety. So I'm very close. And their agenda is very interesting because it's resuming many of the themes of the 80s and 90s. For instance, there's a very strong movement for contraception beyond hormonal methods, very strong. It's women are organizing themselves, epidemiological surveillance of adverse effects of pill, because there is no such thing in public policies. So they are doing this themselves. It's amazing. I've never seen, this is something that I think that we should study this. And one of the things that these women who have adverse effects, they are not reported anywhere. So they are reporting themselves. They do this through Facebook. This is a very new thing that we have to, because the newer pills, we thought it were safer. They are not safer. They are even more dangerous in terms of thrombosis and other problems. So these women who do not have a health background are organizing this themselves. This is a very interesting thing. Because by that time we used the barrier methods, almost those barrier. I came here to India 20 years ago, invited by the Population Council, working with the NGOs who wanted to promote diaphragms. That disappeared after the AIDS epidemic. And they are resuming this with a lot of energy. Sexual diversity, with many other things. The issue of humanized childbirth and the issue of choice of provider, place for childbirth, and so on. Social support for motherhood and parenthood, including men in parenthood, maternity leave, and so on. Motherhood as a social responsibility. There's a whole new agenda on that. Of course, legal abortion, the issue of violence against women, very strong slut walks. You have slut walks here, no? Do you? Okay. 3 years ago, maybe 4 years ago, in Canada, a woman was raped in a campus. And the police said, oh, of course, she was dressed like a slut. A slut? Yeah. And that all around the world, people organized this slut walk saying, the problem is not how we are dressing. The problem are the rapists. So, so this is very strong in Brazil. The demonstrations are huge. The young women and men take part of this, and the issue of this has become a very strong polarization in terms of this. Breastfeeding rights. I've separated this from maternal rights because this is related, as they say, to the right to have a public life. Breastfeeding. So they organized this wonderful initiative called the Cine Materna, for instance. Cine Materna is they organize with the movie theaters special sessions for women who breastfeed. Indeed, anyone who has a baby or a kid can go. So the lights are, a little bit more or light, a little bit less of sound. Place to change the babies. Nobody cares about babies making noise, etc. So they create a whole culture of breastfeeding in public, creating new laws for people not being repressed because they're breastfed in public, support to lactation, and so on. So there's a lot of energy put on this. And I am saying young feminists because the idea of youth is a relative one, but the issue of aging and quaternary prevention. Do you know about quaternary prevention? They did arrive here. It's a new concept. Remember the primary, secondary, and tertiary care? The quaternary prevention is the prevention of depending from medical technology and drugs. So it's a whole. In any age. But the older you are, the more you depend on this, So how to prevent illness and how to prevent over-medicalization, over-testing, over-diagnosis, over-treatment. So this is a very, I think this is the future. Quaternary prevention is the future in terms of public health. And mode of delivery, I will tell, in the next lecture, I will discuss with you about the epigenetics and the microbiome in the perinatal period, especially during childbirth. So the new interpretations of the biology of reproduction, because they are very political and they're going to change the way we think about health and disease. It's very interesting. So quaternary prevention goes in this direction. So these are the new descriptions and narrative of the health experience. Childbirth is being a top one. This is a picture I showed, and sometimes people get a bit shocked, But this is how people are redescribing this experience. And social movement have created this slogan about how to improve the birth experience. This is very strong, demanding new forms of health provision. These are one of the demonstrations about the right of breastfeeding. they call mama, so they go in public for, a way to promote women's freedom as a political health issue. These are the slut walks, and women dress, like sluts to provoke and to say that they have to this. And this is the challenge we have now, going from surviving sexuality and reproduction to enjoying it. Before that, we need new words and narratives, and the innovation goes through these new words and the narrative. This is our challenge presently. So that's it. Thank you.